Okay, Liz, thanks for joining us. Um, I understand you're dealing with psoriasis, correct?
Correct.
Can you give us a little synopsis of your problem with psoriasis? Like where is it? How long have you had it? That kind of thing.
I've had it for about 30 years, and
30
it's
years.
on about a third of my body, mostly my back, my elbows from my wrists up to my middle of my upper arm, both arms. I have some behind my ears and back of my legs, buttocks.
Okay. So as far as being visible in everyday social circumstances, the only place that would really be wouldn't be behind your ears because your hair covers it, but it would be, I guess, on your forearms and your elbow.
And I'm starting to get a little bit right here. It comes and goes. Not
Yeah.
that it's much though.
Okay.
It's very tiny.
How bad is it here?
Let's see. I don't know if you can see in the light, but it starts
Yeah.
here. Starts here.
There's too much light on it. Can you dim the light or something for this
Sure
purpose?
Can. Let's see if I can dim this light.
Oh, there we go. Oh, that
Right.
shows it big. Now, I don't know if it's really that bad. It looks very red to me.
It's very pink right now, yes. Because I just got out of the shower. Many times it's more flaky. It's got and it goes right up my arm.
Oh, okay. I can see that. Yes. All right. Okay. Um, that's got to be bothersome for you had it for 30 years?
Not that bad. It just gradually keeps getting worse and worse.
Okay. So it started off 30 years ago, rather mild compared to now, and then
Just a very small patch on my leg. Yeah.
and then it's gotten worse and worse and worse and worse. Okay. So what do the doctors tell you about it?
Well, I don't go to doctors very often because they just really want to just give me steroids, and I don't want steroids. There's other medicines that they have used for cancer treatments that they've recommended. I don't want to do that. I'll try anything natural, but I won't go the steroid route. Yeah.
So from your experience, the medical profession wants you to take steroids and some cancer type treatment
medicines, yeah,
for it, and you prefer not to do that, and so on. Do they tell you? Do they have a view of what caused it, or what is causing it?
No, they say there's no cure, and that there's that they don't know too much about it, but I don't really believe them. I know there's a cure.
Oh, okay. Well, we shall see, huh?
Yeah.
The EFT approach, by the way, has nothing to do with medicine, and you're aware of that, but I'm just saying that because we got people listening in and so on. And secondly, since I'm not a doctor, I'm not about to play doctor and get in the way of any kind of medications or anything else that you do. We're going to make the assumption here that the cause of this is emotional and or energetic. It's going to be one of those two, okay? That doesn't make us right, but I've seen so many good results on all kinds of issues, including rashes of many kinds, which I'm going to put psoriasis in that box, where we address the possible emotional causes, energetic causes, and then we get some results. So what we're going to do here is you and I are going to look for some doors, some ways to try to noodle out between us what might be the emotional causes and how we might use EFT to address that. Open the doors for you, then of course it'll be up to you to do whatever you do with it from that point forward, okay? So the first and maybe most obvious question I would ask you is, if it started 30 years ago, can you recall around 30 years ago, or somewhat before that, an emotional event in your life?
Yes.
Oh, you can. Okay. And that can you share that with us?
A huge one.
All right.
My mother was diagnosed with cancer and was given 6 months to live.
And she subsequently passed away?
Yes. And I was 15 years old.
Okay. And so, as you recall that right now, do you get any emotional spikes?
I do.
Okay. On a scale of 0 to 10, where 10's the worst it's ever been, what might it have been just now?
Probably a 7.
Oh, a
7.
7. And did you feel it in your body any place, like heart pounding or?
Just my whole face. I feel a lot of emotion within my head, my face. Like I was going to tear up.
Okay. And did you feel it, or I don't know if you normally do this or not, but did you feel it in your psoriasis, if that's the way to say it?
I didn't. I felt it inside my body.
Okay. Do you normally feel your emotions with psoriasis? Your psoriasis acts up sometimes, like if you're really angry, you notice your psoriasis getting to you.
Gary, I don't get angry very much, but I'll get a little frustrated or a little annoyed, and absolutely I feel it in my skin.
Okay.
My skin will start itching. Sometimes my skin will start itching, and I'll ask myself what's going on. And sure enough, I'm a little irritated or annoyed or saddened or anxious.
All right. Therein we have a major clue that emotional issues affect your psoriasis. Okay?
Absolutely.
That doesn't necessarily mean that that's what's causing it, but that's a big fat clue, okay? Because as your emotions come and go, your psoriasis symptoms come and go. Did I say it right?
Yeah.
Okay. All right. Okay. So we're looking at the obvious door is to collapse some of the issues around your mother's passing away and learning of her cancer, which is the way you portrayed it. You portrayed the difficulty about learning about it. Okay. Was there anything else emotionally going on 30 years ago that might possibly have been a cause?
Well, I think when it first started, no, but to get it, have it get worse, I was, in high school, happy as can be, being a, high school free from any cares and woes. But I remember when it was time to graduate, or people were thinking about graduation, which is probably about a year or two later, maybe 2 years later, I didn't want to leave high school. I was happy there. I didn't really have any direction.
Yeah.
So that was emotional for me too. It was a scary time in my life.
So you had to sort of, these are my terms, and I want you to correct them, okay? I'm just using my intuition here. You had to sort of leave the nest of high school.
Yeah.
You had to leave a comfort zone. You had to leave friends. You had to go off and be more on your own.
Yes.
Now I'm making that up.
I think that's very accurate. And the other thing is that I'm one of 10 children.
Okay.
I'm number 5.
You're number 5.
So I was kind of on my own, very independent, and yet high school was a real comfort to me, like you had said.
Okay. Now, I'm also wondering about something else. This is my intuition working, but please, don't, just because it's coming out of my mouth, don't say that's true.
Yep.
I need feedback from you, okay?
Yes, I agree.
I am making some presumptions here. I'm getting the hit, if you will, that there's a parallel between that and your mother, that and your mother having cancer and dying. Your mother is a comfort zone. She leaves.
Yes.
Then you have to rely on high school as a comfort zone, a place where you belong, a loving place to you. Okay? And then that's no longer there, and off you go, okay?
Yeah.
So either, your comfort zone has left you or you have left the comfort zone in both cases.
Yeah. So the little attention that I had from my mother, because she was so busy, now with cancer, was even less.
Yes. Okay.
So that was a comfort zone. My mother was a huge comfort for me, even though she wasn't there too much.
Well, she's got, I'm sorry, go ahead.
No, go ahead. What were you saying?
She has 10 children. You're in the middle. Now, I'm not in your family, but I am making the presumption that you're sort of lost in the flock, so to speak.
Exactly.
Yeah.
Exactly.
I mean, you're not.
My family was my friends at school.
Oh, okay. All right. So So see, one of the things we do as children, as adults as well, is one of our big needs is we need to be accepted. It's another term for love. We need love. Very important thing, very important. And we'll do anything for it, even though we sometimes don't realize what we're doing. Okay. So we've had a central source of love leave you in both cases. High school, mother. Okay. So the obvious tapping points are going to be, very important phrase, tattoo this on the inside of your eyelid so you'll get this phrase. To use EFT on the specific events regarding those things. Now, we could do some tapping and say, even though my mother died of cancer, and that's what, unfortunately, many EFTers do, and they leave it at that because they think that's all you need to do. But no. That's too broad. Because the real issues that fact, of course, is an issue. But underneath that are the specific events involved. You mentioned one of them, the time you were first told of that. That was an emotional thud, I gather. Okay? That needs to be, and that's a specific event.
Right.
When that happens, somebody told you at a certain place, you were in the kitchen or wherever you were told this, and you got this emotional thud. It was fear, it was anger, it was frustration, whatever it was. You need to use EFT on that specific event. Reduce it down to a crescendo that lasts 2 seconds. You hear it, boom, okay?
Exactly.
Because that specific event, together with the other specific events that go on regarding that, I don't know what they're seeing your mother in the hospital, going to the funeral, talking to people. You can probably pick up 10, 20, 40, 50, 80 of these specific events.
Okay.
And see, when we first talked about this, you were still a 7 at the mere mention of your mother's cancer. Okay, and here we are 30 years later. Okay. Probably a bit too long to be carrying around a 7.
Actually, I lied. It's 40 years later.
Okay.
40 years later.
Okay. Still probably a little bit too long to carry things around at a 7. Right. Yes, there's a normal level of this. Yes, we would have sadness. Yes, we wish it didn't happen. But to get to a 7, have your face all flushed and everything else, something is unresolved there. Yeah. And that's a big clue that it's showing up in psoriasis. Okay. I think you said your face felt warm. Is that what you said? Did you say it felt warm?
I'm not sure about warmth, but I could feel something in my face. Yeah.
You could feel it in your skin.
Yeah, good point. Yeah.
Okay, which is where your psoriasis is.
Right.
Okay.
Right.
All right. So the clue here is we've got an unresolved mother issue and perhaps high school issue. Okay. That is showing up in your skin. Now, we can certainly use EFT on these specific events. And the likelihood is very high that your emotional response to the mere mention of your mother passing away, your mother having cancer, will be reduced down to normal. A 1, a 2, but not a 7 in your face all flushing. Okay. Maybe even a 0. Maybe you can just walk right by it. Okay. Now, in my experience, doing that properly will give you that kind of relief. Now, will that give you relief from your psoriasis? We don't know till we do it. Is it likely? In my experience, yes. But again, not a guarantee. Let me ask you your thoughts so far on this, because I need your feedback. I've been talking, giving you my intuition, my thoughts, but I don't run around in your skin and I haven't been in your life. What kind of feedback can we have?
I've tapped on it so many times, but it's always there's always a little bit of a different aspect. I noticed when you asked me, and that's when it came up. So that's an aspect. When somebody else asks me about her, I'm going to have to tap on that.
All right. Well, do this for me.
Yeah.
As best as you can remember.
Okay.
Show me how you did EFT. In other words, you'd go, even though I what?
It would be different times, like when it hit me that there was a couple times that it really hit me that she had cancer. The first time she told me in a way that I said, Mom, by the way, did they ever find out what was wrong with you this summer? And she said, oh yeah, I have cancer. And I was like, oh. And she said, I mean, but the way she said it, everything was fine. But I remember going to school and watching the movie Brian song in English.
Yeah.
And yeah, now I'm feeling a little teary that it's just, that's when it hit me, she had cancer.
Okay.
So I tapped on, even though, I feel so sad when I think about watching that movie in English, and then afterwards I went to the bathroom and cried and cried and cried, even though I feel so upset, when I think about that time in the bathroom, just crying when I found out that she had cancer, when it really hit me that she had cancer. So that's the way I've done it so far.
All right. Let's go to the thing in the bathroom.
Okay.
Close your eyes. Put yourself in the bathroom crying and tell me what number you get to on a scale of 0 to 10.
Probably a 6.
Okay.
7.
All right. Open your eyes. Open your eyes. Open your eyes.
Yeah.
Okay. That's a clue that whatever you were doing wasn't on target.
Yeah.
Okay. Because if we get with EFT down to the really specifics, we can knock things down like dominoes. Okay.
Right.
So that wasn't specific enough. See, now, and that's the clue. It was specific enough. So you were crying. Why?
Because my whole world was being taken away from me.
Okay.
The fear.
Okay. That's different. Those are different words than the sad you gave me a few minutes ago.
But I still feel sad. Yeah, I still feel the emotion sadness. But why am I sad? Because my whole world, the center of my world.
All right.
Was going to die.
All right.
Yeah.
Why don't you, if you would, do a little tapping with me right now?
Great.
On that issue.
Okay.
And I'm just going to ramble around like I typically do. And you're going to need to change or correct my words where appropriate if, I'm not on target or something, okay?
Okay.
So tap with me, okay? Even though I'm here in the bathroom.
Even though I'm here in the bathroom.
And what age are you?
14, 15.
Okay. Here I am as a teenager in the bathroom.
Here I am as a rotten teenager in the bathroom.
Okay. In a puddle of tears.
In a puddle of tears.
Because my whole life has been taken away from me.
Because my whole world has been taken away from me.
My whole world, yeah, okay. My whole world has been taken away from me.
My whole world is being taken away from me.
Is being taken away from me. Okay. I'm young.
I'm young.
I have no other resource. I have limited resources.
I have limited resources.
I've never been here before.
I've never been here before.
My mother was an anchor for me in the sense of love.
My mother is an anchor for me.
In the sense of love.
In every sense. In every good sense.
In every sense. And I have since. Found other anchors.
Found other anchors.
Am I correct?
Yes. But she really, although I didn't show it, she was the anchor.
Okay. And is still the anchor.
Probably, yeah.
Okay. And even though she is, even though she is still the anchor.
Even though she's still the anchor.
The major anchor.
The major anchor.
And I'm still missing her.
I'm still missing her.
It's because I need to resolve this.
It's because I need to resolve this.
Yeah. I know logically. That I have better resources now. And I can leave Mom be.
And I can let Mom be.
Okay. Right up here. You have to give me the words. My whole life was taken away. Was that the right term?
My whole world.
My whole world, I'm sorry, my whole world was taken away.
My whole world is being taken away.
My whole world was being taken away. Between the eyebrows.
Whole world is being taken away.
Okay, side of the eye.
My whole world is being taken away.
Right, you know the points. Keep going.
My whole world is being taken away. My whole world is being taken away. My whole world is being taken away. So they're words to me now, Gary. I don't feel the emotion with those words anymore.
Okay, we're gonna test that in a minute. So my whole do this. My
whole world is being taken away.
Okay, now what I want to ask you to do. By the way, you just sighed. I want you to notice that. And sighing tends to be a sign of emotional release. No guarantee of that. That's just how we see it a lot of times. Okay. So anyway, close your eyes, go back in that bathroom, get into it, and tell me what number you get to.
Probably about a 2.
All right, down from, what was it, a 6 or 7?
Yes.
Okay. All right. But now that I want to test it again, okay? But this time we're going to test it a little bit differently, and that is, I want you to literally try to get yourself upset. It's called vivid visualization. Exaggerate the sights, the sounds, the feelings, everything. You're looking for something to get you upset, and let me know.
So I don't feel it logically. I don't feel it emotionally here, but I feel it in my heart a little bit here, and I feel it in my back. But I don't feel sad, but I feel an ache right here.
Okay. And what number would you give the ache?
I give the ache about a 3 or 4.
Okay. Now, what's interesting about this is I could keep going on the emotional stuff. Like we did. I mean, we just went to a different piece of it than you went to before. You went to sadness when you did it on yourself. Right. It didn't work. At least if it did, it didn't work as well as we might like. So right. We shifted to a different way of looking at it. Yeah. Okay. To what was really going on beneath the sadness, because your whole world, had been taken away. That's different than I'm saying. And it's,
when you said that, I felt a little panic, Gary.
Just this moment?
Yes.
Okay, that means we're still not done yet, doesn't it? Okay. Right. So, but one of the things we could do is keep exploring as to what's even behind my whole world is taken away. We could get down to other specific events behind that, other places where you're in a more mini way, your whole world was taken away. We all have those, okay?
Right.
But since you have a physical sign, I want to aim for the physical sign because that's connected to your emotional. And it may be connected, we don't know this, but it may be connected in a way where if we take care of the physical, we're going to take care of some emotional aspects that may take us a long time to dig into, but they're showing it right here, okay? So tell me again, you have a what kind of sensation here?
A slight ache, an ache.
It's an ache, and I think you said it was a 3 or 4 at one point.
Yes.
Okay. Even though I have this slight, I'm going to call it, what did you call your mother? Mommy, mom, what?
Mom.
Okay. Even though I have this slight mom ache.
Even though I have this slight mom ache.
In my chest.
In my chest.
I deeply and completely accept myself.
I deeply and completely accept myself.
Okay. Slight mom ache.
Slight mom ache.
And keep going.
Slight mom ache. Slight mom ache. Slight mom ache in my heart. This slight mom ache. This slight mom ache. This slight mom ache. This slight mom ache.
Okay. There's your sigh again. What was the phrase that I used a minute ago that triggered you? My whole world
was being taken away.
Yeah, so your whole world was being taken away, right?
Yes.
Okay, what happens?
Again, I feel it deeper in my heart towards my back, but the heart part is gone.
Okay, very interesting. This is called chasing the pain. It's called chasing the pain, okay? So you felt it in your heart, but the heart now, the 3 or 4, is a 0. Am I hearing it right?
My whole world was being taken away. Yep. It's a 0.
Well, a 0, but it's replaced now. It has moved someplace else. And,
Yes.
and that is where again?
Behind the heart towards my back.
Okay, behind your heart and towards your back. And at what number would you give that?
1 or 2.
And is that an ache? Is that a sting? What is it?
Slight ache.
A slight ache. Okay, even though I have a slight ache behind my heart, a slight mom ache behind my heart.
I'm sorry?
Even though I have a slight mom ache behind my heart.
Even though I had this slight mom ache behind my heart.
And my whole world is being taken away.
And my whole world is being taken away.
I now know it wasn't.
I now know it wasn't.
Because I'm here in the world.
But because I'm here in the world.
Okay. All right. Then this slight ache behind this slight mom ache behind my heart.
This slight mom ache behind my heart.
Keep going.
This slight mom ache behind my heart. This slight mom ache behind my heart. Slight mom ache behind my heart. This slight mom ache. This slight mom ache behind my heart. It's almost gone. This slight mom ache behind my heart. So I feel a little in my neck, Gary.
Okay, you tapped under the arm, right?
Yep.
Yeah. Well, the slight ache behind your heart is not there.
It's gone.
Okay, so you feel a little bit in the neck.
It's the same feeling, but now it's in my neck.
It's the same feeling, meaning a slight ache.
A slight ache.
A 1 or a 2?
2.
A 2. Okay. Now we're into simple time, aren't we? Even though I have this slight mom ache behind my neck.
Slight mom ache in my neck.
In my neck.
I deeply and completely accept myself.
Go ahead.
This slight mom ache in my neck. 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 It's still there. I want to say like it's a little knot.
Okay, so it's gone from a slight ache to a knot.
I want to say a little knot. Yeah.
Okay.
So it's not as big. It's gotten smaller.
Well, okay. Is it a small ache or is it now a knot?
It's the same feeling, so it could be an ache.
Okay. All right. You were calling it. See, a knot is a different thing than an ache, and so
Yeah.
I'm being a little picky here. That's all, because I would call it a knot if that's what it was.
Right.
But but the way I'm hearing it now is you had an ache like this big, and then the ache just got smaller. So even though I have this even smaller ache in my neck,
Even though I have even a smaller mom ache in my neck, I deeply and completely accept
and
myself.
keep going.
Even though I still have some of this.
No,
small
up here.
Okay. This remaining. Let me say remaining.
Well, yeah, okay.
This remaining small mom ache in my neck. This remaining small mom ache in my neck. This remaining 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 mom ache in my neck.
So I understand when your mother died or was about to die, that ripped the very center of your soul from you, did it?
Yeah, you know what? I didn't feel any emotion.
Okay.
When you said that, that's different.
Okay, and I tried to use different words. I tried to even different, rip your soul out and all that stuff to try to trigger you. Now that doesn't mean you're totally done with that specific event, but it's a good clue that you've done a lot more with it here than you did when you were, trying to do it sadness. The clue is when you were doing the sadness thing, it wasn't working. And it should work. If it doesn't, you're not on, maybe you're on target, but you're not on the bullseye.
Yeah.
Okay. So we got to keep working around for the bullseye. Okay. As we were doing any of that, did you feel any of the psoriasis come and go?
I did not.
Okay. Would you have normally? Do you know?
I don't know. I don't know. When I'm tapping, Gary, I don't feel the psoriasis.
Okay. All right. Well, you don't have to. I'm always looking for clues and things, avenues to go and barometers and tests and things like that, because testing is very, very, very important along the way, And all this thing with chasing the pain, as you noticed, I was constantly testing. How is it? Is it changing? All that kind of stuff. All that lets both of us know where you are. Anybody listening in, I really want to urge them to go to the testing part of our tutorial, because it puts that out in red, white, and blue. Okay. So, okay. Well, what I wanted to do here was to orient you and give you an idea. So let's kind of summarize here. We've got psoriasis. We're looking for emotional and or energetic causes. In this case, I think they're probably more emotional than anything else. Okay. We zeroed in on two possibilities, two big doors: your mother passing away, and having cancer to begin with, and then passing away, and then your high school, leaving high school, in both cases leaving the nest, in both cases those were your world, your comfort zone, etc. So reduce it down to the specific events for each of those. It's going to take you a while to do it, okay? But your clue in this case is going to be, if you're tapping on a specific event and you don't get anywhere, try again, go deeper. Look at it. Look at it differently, because it'll be there. Now, chances are, tomorrow morning when you get up and you zero in on that specific event we just dealt with, it'll either be gone, or if there's something there, it'll be minor, in which case you want to get rid of that if you can, so. Anyway, any questions at this point?
No, but you've been talking about it, and I'm feeling so free from it right now. Very healthy.
Of that one specific event?
Just both. With high school, with the mother dying, and it just seemed very, like there's absolutely no emotion. But
well, I tell you something. We might get lucky. That might have been foundational enough. And the idea of your whole world being taken away was foundational enough and centered around that one specific event that we may have kicked the center right out of it. I think we would be lucky, but it's not something that's never happened before. Okay.
Right.
Like you're still going to need to do some more. But we'll see. We'll see. Yeah. Okay. All right.
Sounds good.
Liz, thank you so much for sharing all this with us. This is going to be, I think, a lot of help to a lot of people. So.
Thank you so much, Gary.
All right.
Thank you so much.